Tashi Delay, and welcome to Tibet Talks. I'm Ashwin Verghese, Communications Officer of the International Campaign for Tibet, and it's my pleasure to be your host this afternoon. With our world facing historic crises, we at ICT want to help spread the wisdom of Tibetan culture as well as the teachings of His Holiness the Dalai Lama. In this series, you'll hear live conversations about Tibet with inspiring thinkers, leaders, activists, and artists. On today's episode, we have a fantastic guest. She is a professor of surgery and currently the director of the Breast Cancer Center at MedStar Georgetown University Hospital, as well as the regional director of the MedStar Breast Health Program. She has always been a champion of diversity and equality and was the president of the American Medical Women's Association. Our guest has also always been passionate about providing cutting-edge surgical techniques as well as compassionate care to patients with cancer. Her interactions with His Holiness the Dalai Lama and his physicians had a great impact on her life in the way she approaches cancer care, the environmental impact of the Cancer Center, and the importance of gaining a broad education. In fact, she just received her MBA and certificate in sustainability from MIT. So please join me as I welcome our speaker for the hour, Dr. Eleni Tousimis. It's wonderful to have you here, and it's also wonderful to be joined by two of my ICT colleagues who will serve as the moderators for today's discussion. So please join me as I welcome our Director of Member Outreach, Tencho Gyatso, and our Director of Special Programs, Leslie Rich. Tencho and Leslie, welcome to Tibet Talks.
Thank you, Ashwin.
Great to have you here, and we'll start the conversation in just a moment. But first, one housekeeping note for our audience. If you're watching this live and would like to ask questions for our guest today, please email your questions to comments@savetibet.org or post your question in the comment section of the live stream on our Facebook page. With that, I will turn it over to Tencho, who will get the conversation started.
Thank you, Ashwin. Hello, Eleni. Hi, Leslie. So nice to see both of you here. And Eleni, I know you're so very busy, but thank you for making time to join us for this Tibet talk today. We began the series in early May as a way of outreach to share some of the lessons from the teachings and wisdom of His Holiness and the wisdom of Tibetan culture. So earlier in the series, you might have seen we invited Professor Lobsang Negi from Emory University to talk about C learning, which is social, ethical, emotional learning, which is a curriculum based on the Dalai Lama's vision to bring compassion into education system. And it's been introduced in collaboration with Emory University. Later, we also had Dr. Rick Hansen, who spoke about how Tibet inspired his studies in the exploration of the process of brain change and how learning to grow and cultivate traits that help us all become stronger. And today, Eleni, we have you joining us and to share how you've been putting, inspiration you received through meeting His Holiness into practice. And I'm also joined by Leslie. Leslie, you might want to add to that.
So yes, thank you. Hello, both of you. It's lovely to see you again. For those viewing the program today, I should explain that Eleni comes from us from a science and medical background, and she's someone who puts words into action. We thought people would like to hear from you and the changes you have made. As people don't know, your connection to Tibet is that you were recommended to be the doctor on call for a visit of His Holiness to Washington, D.C. in 2016. And then you attended a public talk at American University where you were randomly selected to ask His Holiness a question. And from that answer, you received inspiration to make some sacrifices and changes that both shaped your life and goals in a big way. So, can you share with us a little bit more about your background and what was the question you asked His Holiness that had such an impact?
Thank you, Leslie, and thank you, Tencho. I'm very honored to be here today to share how he inspired me both in my personal and professional life. So when I was nominated for this position in 2016, even though I was honored, I wasn't sure if it would, because as I mentioned earlier, I have been dedicated to specializing in breast cancer for the past 20 years. Is there an echo or no? Okay. And so I wasn't sure if a breast cancer surgeon who solely takes care of women was the appropriate fit for taking care of a man in his 80s. And when I was interviewed for the position, I was told that His Holiness didn't care about the physician's pedigree or specialty. He just cared that the physician had a great mind and a great heart. So I immediately answered, I'm in. And shortly thereafter, he visited Washington, D.C., and was at American University, where I had the opportunity to ask him one question. So in preparation for his lecture, I actually did a lot of research about his interests and his passions. And as we all know, he's very interested in science. He's one of the few religious leaders that believes in science. He's passionate about technology as well as compassion. So I asked him, in a world surrounded by technology, what advice would he give to physicians to maintain compassion? And he loved the question, and he answered it in detail at length. And to summarize his answer, he basically said that as physicians, we've had years of specialized education, and that before making any big healthcare decisions or recommendations, we should use a combination of our knowledge as well as our compassion. And I really think that this resonated with me, and I took that back to my practice.
Thank you for sharing that, Eleni. Now, I had my mic turned off. So after that initial meeting, you decided to make a trip to Dharamsala with us.
Mm-hmm.
So you came on our annual member trip, and you had a chance to meet many more Tibetans and see firsthand Tibetan culture, from politics to arts, social service, to spiritual life, to education. But I think you were particularly interested in visiting the Delek hospital there and meeting with Dr. Tseten Dorji Santusang, who is His Holiness's private physician. And also you had a very interesting visit to the Tibetan Medical Center there. Can you share with us what were your impressions and lessons from that experience?
Sure. So basically, after His Holiness' visit to Washington, D.C. in 2016, it became apparent that he wasn't going to be returning to Washington, D.C. as frequently as he previously had due to his decreased travel schedule due to his advanced age. So I invited the leadership from the International Campaign for Tibet to our home in Washington, D.C. to thank them for the honor of this position. And while they were at my home, they basically explained that if I wanted to have interaction with him and his team of physicians in Dharamsala again, that I would have the opportunity to travel with their group in the fall of 2018 to Dharamsala. And this was an incredible experience for me. I've never been to this part of the world. And my personal goal was to learn more about Tibetan medicine. And wow, did I learn a lot. So I had the privilege of meeting Dr. TD, who's the personal physician for the Dalai Lama, while I was there. And at the same time I was there, he had organized and was hosting a wellness conference where he had invited international speakers. And they were really focusing on the benefits of mindfulness and incorporating the practice of mindfulness as early as childhood all the way through adulthood. And basically, Dr. Didi explained to me that every morning he practices mindfulness with his team before they start seeing patients, and how this team mindfulness actually organizes the whole group together and aligns their intentions of what our purpose is as providers, that we are there to help others and make a difference, whether big or small. So actually, when I returned back to Washington, D.C. in November of 2018, I started to incorporate mindfulness into our team. And I personally did not know how to practice mindfulness. So I actually reached out to one of my classmates at MIT who owns yoga studios and this is her area of expertise. And she taught me how to do this. And I actually just started using an app on my phone. And at the beginning, it was just a small group of about 3 or 4 of us. But very quickly, it grew fast within the hospital and through the cancer center. And I was introduced to an integrative medicine doctor. She's actually photographed in this picture, Dr. Stone, this is her area of expertise. So she incorporated into our group and she became the teacher and led these morning meetings of mindfulness. And within 8 months, our morning practice converted into palpable results where we were voted as the #1 in the hospital for patient satisfaction. And this is a photograph of our group. And most of us in our team had never practiced mindfulness before. So this was a great example of how what I had learned from the Tibetan doctors and Dharamsala, how incorporating these small practices can make such a big difference in patients' lives.
Well, thank you. I mean, that's wonderful, and your patients are are lucky to have you. So beyond the meditation, putting the meditation into practice is impressive, and so many people go and meet His Holiness and hear him and do their own practice, but they don't carry it forward beyond that. So what, besides the meditation, what other changes have you made and what else have you done?
Yeah, so actually, I think you just had a slide up previously, which is a new program that we started at the hospital, and this was all inspired from both my interaction with His Holiness, his medical team, as well as my mentors at MIT. We started a project called the 3P program, which really focuses on the wellness of the people that we work with on our team. And I always put people first because I believe that if the people on your team are not healthy and happy, then they're not going to provide great care to patients, and especially cancer patients who are so vulnerable and anxious and really in need. We also incorporated scholarships, and this just happened this past year through the generosity of donors to actually encourage our team members to go back to school to broaden their education, which, as we all know, is one of the pillars of His Holiness. And we then focused on the patients, and we really decided that we really needed to address the breast cancer center to make it a more welcoming and environmentally sustainable space. And that was the 3rd P, which is our focus on planet and incorporating these environmental sustainabilities. And we completely gut renovated the breast center. We completed the renovation about 8 months ago, and we used completely recycled materials. And this is a really nice before photo. You can see it looks a little bit dated and dark. And this is the after photo. And in addition to the recycled materials, we used LED lighting, low flow toilets, non-adhesives because we felt that we wanted to remove all toxins. And we actually have a current initiative to be plastic free, which is, as everyone knows, is very challenging in the healthcare setting. And we're starting new initiatives in the operating room to decrease waste and decrease our carbon footprint. And we worked closely with our architects. And as you can see here, the architects from VOA incorporated these tree trunks because it was really important to us that we had elements of nature in the breast cancer center.
Thank you, Eleni. Wow, for sharing all that. That's kind of, our viewers can see why we invited you, because every time we met you, we were learning something new that we were doing. I want to ask you, I know we've heard you just graduated from MIT also. Can you share with us, with our viewers, how His Holiness impacted your going back to school?
Yeah, so in preparation for his arrival to Washington, D.C. in 2016, and as I had mentioned, I had read a lot about his interests and passions, his core values and beliefs, and one of them is his strong belief in a broad education. And even though I'm a cancer surgeon and I've dedicated basically my whole life to studying this one skill set, I felt that deep down that I did not have a broad education and that my education was very narrow. And I felt that it was important to go back to school to broaden my education. And it's very unusual for a cancer physician to get a business degree, because you wouldn't think that the two actually match. But by getting a master's in business, it actually enabled me to really delve in and learn about so many different skill sets. And His Holiness, as most of the viewers know, has a very strong collaboration with MIT. And as I mentioned earlier, because he's one of the few religious leaders that believes in science, he's actually been invited multiple times to MIT to talk about the benefits of mindfulness. And they invited some of the world's leaders in neuroscience and delving into the human mind. And so basically, when I was thinking of going back to school, there was actually only one program that I looked at, which was the Master's in Business program at MIT, because I thought as a physician, going to a school that really is focused on science and technology would be the best fit for me. I just graduated a couple of weeks ago, and I found the program to be extremely rigorous, but inspiring and transformative for me. And in addition to my Master's in Business, because of my trip to Dharamsala and learning so much about the environmental impacts and climate change, I actually achieved an additional certificate on sustainability. And one aspect of that is actually focusing on environmental sustainability.
One thing I wanted to add is that, Eleni, it's probably not in your presentation, but you kept a schedule kind of like His Holiness also. His Holiness gets up at 3 o'clock and he works through the day, and you were doing that and hopping between two cities, between Boston and DC, and you really worked very, very hard to get here.
Yeah, and that's actually, I'm glad you brought up his routine, because he's such a believer in getting a lot of sleep, and I am a huge believer of that as well. And when I'm, counseling my patients, I always stress the importance of getting a lot of sleep. So similar to His Holiness's schedule, I used to go to bed extremely early and wake up anywhere between 3 and 5 in the morning to actually study before I went to the hospital. And then I was flying to Boston actually every other week. So it was very challenging. And I did that for about 2 years. So now that that's all stopped, I look back and I said, I don't even know how I did that. That was really tough. But like I said, it was one of the most inspiring and rewarding experiences of my life.
It's really, really incredible. I don't think I could have put that level of dedication to getting it done. And now that you've done this and you've taken all that you've learned and you're sharing it, and I mean, I've heard personally from people who have been to your seminars and they've come back and they've incorporated it into their own thing. So you're spreading this knowledge. Can you tell us a little bit about that and how that happened, and what's been the reaction to it from your colleagues? We know the patients are very appreciative, but change in the medical world can come slowly in how the interactions are done. And so I'm wondering, how has it been received?
Yeah, so this past year, MedStar Health has a branch of the hospital system which is dedicated to science and innovation. It's called MI2. And I was invited to give a lecture on how His Holiness impacted my personal and professional life. And so it was really interesting because the invited speakers, many of them, or most of them, were scientists. One of them was a Nobel Prize winner in mathematics. So my topic was very, different from everyone else's topic. And so the audience was composed of about 500 scientists and healthcare workers. But I basically shared with them how everything I learned from His Holiness, including his commitment to saving the environment, his commitment to wellness, mindfulness, and especially nowadays, we're facing this global pandemic, and the stress amongst all of us is so high. And the healthcare workers who are on the front line, who are going to work every day with courage, and I'm so, I hold my team in such admiration. Not for a second did they ever have hesitation to continue to go to work, to take care of the patients, especially when the pandemic first started. So I feel as though His Holiness inspiration and his dedicating to mindfulness and wellness now more than ever is really important. And so basically, I shared this with this group of scientists, and it really resonated with the entire conference. And at the same time, I'm doing my schoolwork. So that evening, after I gave the talk at the MI2 MedStar Health Innovation Conference, I came home to write a paper, and it was due at midnight. And I received a text message for one of my classmates, who's a very successful CEO of a company called Coding Dojo, which is a company that teaches students how to code. And he is located in Seattle. So he texted me late in the evening because he had known I had given this talk about His Holiness. And he basically asked me, what's the purpose of life and the meaning of life? And I really didn't even know how to answer him. So I really wanted to dive in deeper and learn more in order to give him a better answer. And so when I was reading, everything really pointed back to His Holiness's teachings, that in order to achieve happiness, we have to be generous spirit in our spirit and give to others. Because if we do community service and help the lives of others, it's actually helping ourselves, and it's giving us true happiness. And we also have to create peace within us and peace around us, because by doing so, this will also help to achieve happiness. And so I also kept seeing these words, purpose and passion. And so basically, I told my classmate that it all comes down that happiness is defined by not only creating peace, but having a purpose in life, living a life with meaning, and also having a passion. And if you have these 3 P's, then you can truly achieve happiness. So after I gave that talk at MedStar Health this past fall, I was also asked to share my experiences with the entire community of the business school at MIT. And just by coincidence, it was on my 50th birthday. This was in January. And I thought it was a great opportunity for me to reflect on my life and my personal and professional inspirations. So basically, as most of us know, MIT is really based on mathematics, and everything comes down to a mathematical formula. So I basically had shared with them that I defined happiness by P cubed equals H. And I was explaining to them that when I started business school, a lot of people had said to me, Eleni, you're destined to be a hospital president and to have all these, corporate leadership responsibilities. But as I got deeper into the school program and into my readings about His Holiness and his core beliefs and values, it became very apparent to me that it's not about climbing this corporate ladder. It's not about obtaining more money. But it's really about finding passion and purpose in your life and striving to create peace within yourself and around you. And I think once again, that also resonated with this audience, which tended to be a mixture of business people, engineers, from a different background.
P cubed equals H. I like that. And you were saying you have that printed and written around to remind you also.
Exactly.
Yes. Which reminds me also when His Holiness was in DC last with an ICT event, he shared with the audience, with the members, that he has many ideas, but he has only 2 hands, and that he needs more hands, and we should all be like his hands. So, I think of what you're doing also like that. And when you shared the PowerPoint that you had shared at the other events, and you talked not only about that, you talked about Tibet, the history, the life of His Holiness, and then you also told people where to go now to take action, and you talked about the Tibet Policy and Support Act and what they can do. So you really did a broad, you extended, you became one of his hands also in doing that, in extending the work. Now, after all of that, also, can you share how it impacted your personal life? Because I know you have 2 young boys. We have viewers who are listening who have children, and would be interested to hear from you how you were able to share that with your children. But before you speak, I might just add for the viewers out there, we'll be opening up for questions shortly. So please, if you have questions, just write them, or comments, anything you would like to share, please write them below the Facebook live stream, and we'll get to them. So thank you. And Eleni?
Yeah, so basically my children, when I was nominated for this role, my children were 5 and 6 years old. And as I had mentioned before, I really started reading deeper into his philosophies and core values. And as everyone knows, he loves children. I mean, his laugh is contagious. His curiosity is unbelievable. His intellectuality is really something that's so honorable. And so basically, when I learned so much about his value system, it really made me think, and my husband as well, about how we wanted to raise our children and what values we wanted to give them. So it wasn't, and it's almost similar to my personal journey, where it's not about climbing a corporate ladder and obtaining more money. Also for the children, my husband and I, our goals are not for the kids, to force them into a certain career or to encourage them to take jobs just for money. We really wanted to teach our children that it's important in life to be happy. We want them to be healthy, and we want them to have a broad education. So in addition to that, we wanted to teach our children empathy and spiritual generosity. So every year in Georgetown, where we live, the boys would host a lemonade stand. And if you can see on this picture, these are my two boys, Alex and Luke. And every year they'd have a lemonade stand outside, and they would explain to the passerbys that they were raising money for the breast cancer center. So this past year, they raised $1,000, and they donated all of the money to the breast cancer center. And here they're photographed with Mike Socklaven, who's the president of MedStar Georgetown University Hospital, and they're presenting the check. So by doing these small acts, you're teaching children from a young age that with just this small effort, you can really make a difference in somebody's life. And I think that's important to teach people early on what satisfaction they can get out of generosity. And I always tell my kids that when I pass in life, I always want to be remembered as a generous person. I think it's a really important value, and it's something that it really can make a difference in someone else's life. And as I mentioned earlier, by being generous, it actually also helps yourself, and it gives back to yourself. So these are some ways that we've incorporated this into our parenting. And we also, at the beginning, because the kids at that, when they were 5 and 6, they were also very active, and we started doing mindfulness with them, which I noticed made a huge difference and really helped calm them down. And I encourage parents during this pandemic who are isolated at home with their kids to also try to practice this, because sometimes it only takes a couple minutes and you can really see big differences.
It's our bedtime ritual now for my own 9-year-old. And that's really wonderful, because it is rough on the kids this time. It's so, for them, it was like flipping a switch. Anyway, but what now? You've done all this, and how else, since Tenshel had dubbed you one of His Holiness's hands, which is pretty big responsibility, how are you going to continue to carry that forward?
So yeah, everyone, all through business school, everyone's saying, what next, because they feel like when you go back to business school, you have some hidden agenda of something that you want to accomplish. And so as I had explained earlier, I think I really evolved during my 2-year educational process, where I don't feel like it's all about climbing this corporate ladder. And when I graduated from school recently, I graduated during this global pandemic. And I think at this point in time, I'm just so appreciative to, first of all, have my job, and have a job where I can make a difference in someone's life and see this palpable, immediate difference. I'm very appreciative of the team that I work with, because as I mentioned earlier, they practice their lives every day with compassion and empathy for the patients that we take care of. And also, I feel as though it really comes down to the P cubed equals H, where I'm just focusing right now on doing good work, and I'm focusing on maintaining passion for my work, maintaining purpose, and then creating the peace within myself and around me for my whole team.
Thank you, Eleni. Thank you. And with that, I wanted to invite Ashwin up. We may have some audience questions who are listening, so I'll turn it over to Ashwin.
Yes, thank you, Tencho, and thank you, Eleni, for that wonderful presentation and for sharing that with all of us. I know we have a lot of folks watching now online appreciating this, so thank you again for being here. And actually, one of the first comments we received is more of just a compliment than a question, but I'll be happy to share that. It's from someone on Facebook named Jennifer Ballard, and Jennifer writes, "What a great example for medical practitioners everywhere." So I just wanted to share that with you, and thank you again for providing that example for many other doctors and medical professionals. And to kind of build off of that, one question that we did have, and we're seeing, I know that you sort of touched on this in your presentation a bit, but for other doctors out there, other people working in the healthcare field, especially right now as we're going through this really unusual time where people are having to practice medicine without actually being in physical contact with their patients in many cases, or just having to go through all sorts of hurdles that never existed before. Do you have any other advice or any other bits of wisdom that you might be able to share for people who still want to take care of their patients and want to provide them with the highest level of care, but are dealing with the stress and the difficulties of the situation we're in right now?
That's a great question, Ashwin. And Jennifer, I want to thank you for that comment. And just as an extension of what you said, Jennifer, I was actually thinking about it this morning, that nowadays it's no longer enough to be a talented surgeon with your skill. You also, as a physician, you need to couple that with compassion and empathy. And I actually think that's part of the healing process, is having a physician that you believe in and also gives you the mutual respect. So I wanted to thank Jennifer for that comment. And Ashwin, to your question about the pivot now in healthcare with the global pandemic, it's really forced us as physicians to offer telemedicine, whereas prior to the pandemic, it was harder for us because there were so many regulations that prevented us from being able to offer this service. And counterintuitive to what most people would think, as a physician and someone who's always used to touching people and diagnosing them with physical exam, I thought at first, oh, this is going to be really hard to talk with someone and basically figure out what's going on with them over a video conference. But I've actually found the opposite, and I've found that telemedicine can actually be more compassionate, because now I'm actually looking into someone's home, so I can assess how they're living. And I've had patients who are in their 90s where I've done, telemedicine conference calls, and I can tell, okay, do they have a supportive family? Do they have a social system at home that's going to help them after they have surgery? Do they have stairs in their house that they're able to climb up and down? I find that the visit is now really focused on the data that I'm provided, such as their imaging, their laboratories, all their reports, instead of focusing on, issues with getting to the hospital and the delays because there was an accident. So I actually find that it's a really good experience for the patients, and overall the feedback has been really positive. So we've actually opened up a new research study at MedStar where we're looking at what percentage of the time does not doing a physical exam, so me never touching the patient, what percentage of the time does that change the recommendations of a surgeon? And we actually just opened that study this past week, and it's too early to know what the data is going to show, but my suspicion is that our recommendations as surgeons probably don't change very much in the breast cancer field by not doing that physical exam, because we're basing so much of the recommendation based on their imaging and the data that were provided. So it's a really interesting time for medicine, and it's really forcing us to pivot very fast in a new direction. And I wouldn't be surprised that even after the pandemic, these changes of offering telemedicine are going to persist because the feedback from patients has been so positive.
Thank you for that. That's really wonderful. And I think, yeah, we are all kind of wondering what things that we've learned and what new skills we've learned during this pandemic that we want to continue afterward. So we do have some more questions coming in, but I believe Leslie actually had another question that she wanted to ask, and so we'll switch to her.
Well, it's an interesting follow-up from what you just said, because this is state of the art with everybody having Wi-Fi in their home and the ability to communicate like this virtually. But when we were in Dharamsala, you had the experience of Tibetan medicine. When you go, it was to the Tibetan Medical and Astrological Institute. You get a tour of their museum, which is the history of Tibetan medicine, all the herbs, all the minerals that they've been collecting and preserving to make certain that they can carry on in exile and create the medicines that people have been using for centuries. And then you have the experience of a visit with a Tibetan doctor, which is the complete opposite end of this. So I wonder if you have some personal experiences you want to share about that, or what your thoughts were about that type of visit.
Yeah, so now that's a great question, Leslie, because as you remember, I did have an experience there with the Tibetan doctor. And the reason that I met with a Tibetan doctor was I was trying to learn the way Tibetan physicians practice medicine. And so as part of that learning process, I went as a patient, and to have the Tibetan physician do a history and a physical. And after she took the history from me, she actually took my pulse. And right away, she said to me, "Do you have a sore throat?" And I couldn't believe it, because it was something that I didn't share with anyone, that I had a severe sore throat, but I didn't want to make a big deal of it because I felt fine and I didn't have a fever, but I definitely had a bad sore throat. And I said, "That's incredible. How did you know that?" And she said that the Tibetan physicians study for 7 years pulse diagnosis. So it's the skill of diagnosing disease based on the characteristics of the patient's pulse. So it's an incredible example of basing or diagnosing disease by really picking up on the changes in the patient's body with not having to use CT scans and all the expensive testing that in Western medicine we traditionally use. And it's another example, as His Holiness says, all he cares about is that you have a great mind and a great heart. So that's part of having a great mind, where the Tibetan physicians learn the skill of diagnosing disease based on pulse. And who knows, someday maybe the Apple Watch will have that ability to incorporate that into the watch. And it was something that I actually suggested to the scientists at MIT, that we incorporate these into Apple Watches, where they really pick up the characteristics of the pulse and can interpret that and translate that into certain diseases. And who knows, someday in the future, we might be there where science and technology, collaborates with ancient medicine and is able to provide that same level of skill.
Well, that would be wonderful. If Apple wants to go and talk to Tibetan Medical Astrological Institute, I'm sure that they're there waiting for that conversation to begin. That would be awesome.
It would be.
Yeah, that would be wonderful. Yeah, thank you both for that. So we do have a few other questions coming in here that I'd like to share. So first, we have a question from Tenzin Robsong, and this came in through Facebook. And the question is, I think this is a really fascinating question, actually. How can we avoid feeling burnout in regards to feeling too much empathy for patients on a daily basis? So yeah, I think that's a challenge a lot of people feel as they're trying to live more compassionately. It can be emotionally exhausting, and I'm sure for someone like you who works with patients who are often dealing with a very difficult situation, it can be something that you have to confront all the time. Do you have any wisdom that you could share on that question?
So that's a great question, and I'm not sure if he's a physician or it sounds like he's a healthcare provider. I mean, burnout amongst physicians has increased dramatically in the last several years. I actually had started writing a book called Healing the Healer a few years ago, and when I started looking in the data in the literature, it was so depressing that I actually had to stop, because just writing the book was depressing me. So I do know a lot about physician burnout, and it's something that, as leaders in a hospital and in the program, and a lot of the hospitals are actually starting to have chief sustainability officers that are focusing on wellness. I know at MedStar we've had a lot of new initiatives at the medical school as well as in the hospital, incorporating wellness and mindfulness with medical students and surgery residents. And there's been a lot of published data showing that just by incorporating mindfulness, it can actually decrease anxiety, stress, inflammation, can decrease heart rate, blood pressure. I mean, the list goes on and on and on. So I think that's one way to actually, combat burnout from work. And then basically, as I mentioned before, I think also getting a lot of sleep is really paramount. A lot of us, especially in the digital age, and we're constantly connected to digital devices. And, Arianna Huffington has written a lot about this because she's also a huge proponent of sleep. And the first thing that she recommends in her book is you have to remove all the digital devices from your room. And for me, as a provider, it's a little challenging because I'm on call. So I can't completely get rid of my phone, but I have disconnected computers from the room. I don't have any of that stuff in the bedroom. And I think that's really important, and not to be on the computer right before you go to sleep because the blue light can actually interfere with their circadian rhythms and prevent you from getting into that deep sleep. But I do think that getting really good sleep is very important to feel healthy and to combat burnout.
Wonderful. Thank you for that. So yes, some more. So questions are still rolling in here on Facebook, so that's great. So I have a question here from a name that I think we all know well on the panel, especially Leslie. And this question comes from Barbara Heller-Friedel. And the question is, in these dystopian, dysfunctional times, how can an individual achieve peace, purpose, and meaning? And where do we find this in isolation? So a challenge that we're all dealing with. How do we find that in a time like this?
So thank you, Barbara. That's a wonderful question. And I'm not sure if I have, the perfect answer, because I think nowadays in this crisis, probably nobody has the answer. I do think that maintaining connectiveness with others is very important, whether it be through, video conferencing or telephone calls. I also think that this crisis has been an incredible time. And, as we all know, sometimes good things come out of bad things. And I think a lot of people are taking a pause in their lives and really reflecting on, are they achieving purpose and passion in their lives? And does their job give them fulfillment? And some people have been furloughed. A lot of people are out of work, and it's really forcing them to pivot to maybe go into a different direction and truly pursue their passions. I see this all the time with my cancer patients, that when they're faced with the crisis of a cancer diagnosis and they're faced with their mortality potentially, they really reassess their lives about what's important to them. And if they have a bad relationship or abusive significant other or an abusive boss, they tend to actually, remove those situations from their lives. There's a very high divorce rate amongst cancer patients, as well as a lot of them pivot and change careers. And I find that after they've been through the cancer treatment, they actually spiritually are a happier person after they've survived, all the side effects from the treatments and the stress of it, because they really reevaluated, what's important in their lives. And I think also with this pandemic, it's, synonymous with that this is an opportunity for many to really pursue their passions and find their purpose, because we're going to survive this pandemic and life on the other side is going to be bright again. And this is a great time for many people to pivot.
Yeah, that's really fascinating. A lot of that was actually very counterintuitive from what I expected. So that was really very interesting to hear. And it actually kind of segues nicely into another question that we have here. And this is also from Facebook. It's from Losong. And the question is, and you sort of touched on this a bit, but the question is, do you think that there are any correlations for cancer patients between their ability to fight the disease and the level of peace and tranquility of their mind? And if so, are there ways to help patients achieve greater mental peace?
Losong, that's a great question. And I'm very empathetic with all of my patients that are newly diagnosed with cancer and going through treatment at this time. And I explain to them, and I was just seeing patients yesterday, and I was telling them it's not only stressful and anxiety provoking facing a cancer diagnosis, but can you imagine undergoing cancer treatment, facing a diagnosis in all its complexities during a global pandemic, when you're not even sure if you can access your doctor, if you can get the care in the timely fashion. A lot of the patients, when it was thought unsafe to be in the operating room, they were actually referred to get either chemotherapy or medication prior to surgery. So all the uncertainties surrounding cancer during a global pandemic really added to their anxieties. There's a lot of things that we can offer patients to help them achieve peace, especially when they're under cancer treatment and all the anxiety surrounding it. And in addition to the mindfulness, there's lots of benefits with acupuncture, which has been very, very beneficial amongst these patients, as well as exercise. Even doing as little as 3 times a week for 30 minutes, that can actually help lower the anxiety and increase quality of life. So these are some small things that we can incorporate into the treatment protocols, as well as nutrition. Nutrition is really, really important. It's a lot of cancer patients, when they're faced with a diagnosis, and especially with breast cancer, most breast cancer patients don't have a family history of breast cancer. And a lot of times they don't even have any symptoms, and it's picked up just on routine imaging. So the diagnosis kind of comes out of nowhere, and a lot of them completely change their lifestyles. And nutrition is one way that they can change their lifestyle, and especially by avoiding sugars, high fat content. They also avoid red meat, and they also switch to all organic, because a lot of the meats that are not organic have antibiotics and preservatives, which can really decrease the immune system by causing inflammation. So that's another way that cancer patients can really change their lifestyles, which just puts them on the path towards wellness.
Wonderful. Thank you for that. And we have another question here from Vivian Nosti. And this question is, what's your advice on getting sleep? It's really difficult for me now, especially during this pandemic. So that's what Vivian is asking about. I think many of us are experiencing a bit of a shock where we have our workplaces now kind of down the hallway from our bedrooms, and so that can make things a little bit more challenging, I think. What is your advice on having good sleep habits and making sure we get enough sleep?
Okay, so Vivian, that's a great question, because honestly, I have suffered that as well. I'm always somebody who got 8 hours of sleep. I never had any issues falling asleep. And during the pandemic and right after I graduated from school, my sleep as well is really fragmented and disrupted. And I think not having this structured schedule in our lives anymore and being surrounded by so much uncertainty, it causes a lot of underlying anxiety and stress. So for me personally, I found that there's some things that you can really look at to make sure you're not doing. So one thing that I was doing during the pandemic that I wasn't doing before was I was drinking a lot of coffee. And I think that was like the biggest perpetrator of my sleep disruption. So one thing to do would be to assess how much caffeine you're actually intaking. And if you need to have caffeine or you enjoy your cup of coffee, really try to avoid having coffee or caffeine after noon every day. That's what I've done, because I've noticed if I drink coffee after 12 noon, it really disrupts my sleep. And you could even try avoiding coffee altogether or any caffeine altogether to see if that makes a difference. Try to drink a lot of water, because if you're a coffee drinker and you're not drinking 2 to 3 glasses of water for every cup of coffee you're drinking, you'll get very dehydrated, and that'll also make you very sleepy. Also, try to incorporate exercise into your routine. And I know nowadays, the gyms are closed. I know they're starting to reopen, but even going for walks, doing exercise in your home. I have a lot of patients that are doing online yoga, which is actually really helping them. Some patients use melatonin. That can actually help get your circadian rhythms back into regular order. And then, as I had mentioned earlier, removing digital devices from the bedroom. If you're able to do that, that will make a big difference as well.
Keeping the phone turned off
Yeah.
when during your sleep time. I've been trying to do that, keep the phone turned off, which is.
And the rest of us are trying not to call her in the middle of the night with work news or anything too. So group effort here.
Yeah.
And we do just want to shout out. So Vivian is actually one of our volunteers at ICT. So I want to thank her not only for watching and listening, but for all she's contributing to ICT and to the Tibetan movement. So thank you, Vivian. We appreciate all of your support.
Hello to Vivian.
Vivian. And so we're starting to run low on time here. And you've been so generous with us to be here and take time from your busy schedule and your important work to share your advice and some of your personal stories with our audience. Eleni, before we wrap up here, though, I do just want to give you an opportunity. Are there any final words or any final bits of wisdom you'd like to share with our audience as we kind of conclude the show here?
Well, I just wanted to say that I was so honored back in 2016 to, be asked to be in this role. And like I mentioned before, it was an unexpected nomination, but it truly was something that's changed my life for the better. And I'm super excited for the future and where it's going to continue to grow, because I believe we all evolve and grow, and I'm excited for the future direction. Thank you.
Thank you very much. Yeah, that's wonderful. And it's great to end on an optimistic note. So thank you for sharing that. And thank you so much for being here. Thank you as well to Tencho and Leslie for moderating today's event. It's been great to work on this all together. And so we are, just about out of time here. But as I mentioned, I want to thank everybody for participating in this event. And I want to thank all of you who are watching and listening from home. As we've discussed during this episode of Tibet Talks, we know that this is a very difficult time for our entire world right now. But we're hopeful that these discussions can help motivate you to take positive action in your own life and positive action for the people of Tibet as well, and try to make a difference for them. As Eleni showed, if we follow the teachings and the wisdom of His Holiness, all of us really can do our part to try to make this a better world for everybody. So I hope you took that inspiration from today's discussion. So next week, we are actually going to be taking a break from Tibet Talks, but we will be back at a special time on Monday, July 6th, to celebrate the 85th birthday of His Holiness the Dalai Lama. So it'll be a fantastic occasion for all of us. This amazing Tibet Talk will feature the person who co-founded ICT, the International Campaign for Tibet, and served as a special representative of His Holiness the Dalai Lama in Washington, D.C. We'll also hear from several ICT members who will discuss what the Dalai Lama has meant to them and how he changed their lives. So it'll be a great opportunity to celebrate the life of this great Tibetan spiritual leader. We hope that you will join us for that, and we hope that you will take part in our celebration of His Holiness's birthday. So we look forward to seeing you then. In the meantime, thank you for watching today's episode. And to paraphrase Professor Tenzin Dorji, our first ever guest on Tibet Talks, stay safe, stay well, and stay active. Thank you, and Tuk Che.